Hi, my name is Marisa Park. I'm a dental hygienist and birth ambassador. Is snoring killing you in your sleep? If you are pregnant, can snoring also starve the fetal heart of oxygen? We often think snoring is an annoying habit our significant other or family members do. Or you might be the one snoring. But is snoring normal? I can talk about snoring all day and how it affects total health, but for the sake of time, we will focus on pregnant moms and their developing babies and what happens if you're snoring every night. I am a mother of two beautiful children. Every time I visit my OB, I would always get a little lecture on gestational diabetes. I was never asked about how is my sleep? Am I tired in the morning? Do I occasionally fall asleep while driving? Or do I snore? When I first heard the term gestational obstructive sleep apnea, my curious mind started Googling about it. My husband would complain about me snoring, and snoring is not normal. And is snoring normal during pregnancy? It's more common than you may think. Over 3/4 of pregnant women say they experience more sleep disturbance, and while it may make for one tired mom to be, it's still considered very normal. Less typical, however, is obstructive sleep apnea, OSA. It is a condition that strikes more often during pregnancy and causes your breathing to start and stop repeatedly during sleep. Sleep apnea deprives your body of oxygen. It can be serious for both you and your baby on board. Sleep apnea is a chronic condition that occurs when the airways collapse during sleep, temporarily blocking airflow and causing involuntary moments of breathlessness or shallow breathing. Temporary pauses in breathing, called apneas, can last anywhere from 10 seconds to a minute or more. A level of sleep apnea you have is based on the number of times you stop breathing in your sleep. People with mild sleep apnea typically have 5 to 14 pauses in breathing an hour. Those with moderate apnea have 15 to 29, and those with severe sleep apnea have more than 30 episodes an hour. All pregnant women have an increased risk of obstructive sleep apnea because higher levels of estrogen during pregnancy can cause the mucous membranes in your nose to swell, leading to nasal congestion. As you work harder to breathe, the lining of your airway can swell too, constricting airflow. This chain of events can make sleep apnea somewhat more common while you're expecting. About 8% of pregnant women enrolled in a study develop symptoms at mid-pregnancy. If you're overweight, obese, or gain too much weight during pregnancy, you're particularly at risk of obstructive sleep apnea. Extra tissue in your neck can block your airway and make it harder to breathe at night. Moms-to-be with gestational diabetes are also at higher risk. Other reasons your airway may collapse or become blocked during sleep include congestion caused by allergies or illness, along with certain physical attributes, a receding chin, enlarged adenoids, large tongue, a deviated septum, or an above average neck circumference. What happens when the snoring starves the fetal heart of oxygen? As the child grows and the lungs and the respiratory systems are cramped, breathing compensation means there is a higher chance of increased pressure and snoring during sleep. Less oxygen to the fetus increases the incidence of pregnancy complications and neonatal morbidity, such as intrauterine growth restriction, organ development, and neurobehavioral disorders in neonates. Fetal hypoxia exposure is known to impair fetal cardiovascular systems. When it comes to sleep apnea in pregnancy, recognition and treatment of sleep apnea can be beneficial to a healthy pregnancy. Physicians are encouraging consistent sleep schedules, sufficient sleep duration, generally about 7 to 9 hours per night, and treating problems with insomnia or sleep apnea are recommended. Pregnant women, they need to maintain the same bedtime and wake time each day, limit caffeine consumption, especially after 1 p.m., and limit screen time before bed to reduce the chances of developing sleep apnea. Make sure you're not overnapping during the day. Finding a good sleeping position, lying on their side with their knees bent, is likely to be the most comfortable position. I used to use a pregnancy pillow just like this one. I think that was the best present my husband gave me. Sleeping in a position allows the heart to carry blood back to the heart from the legs and feet more easily, as it decreases the amount of pressure that the baby applies to the inferior vena cava And the most effective treatment for sleep apnea is a continuous positive air pressure. It's called CPAP machine. It is a device worn at night that keeps the throat from collapsing. The risk for preeclampsia and gestational diabetes is higher in pregnant women with sleep apnea. At this time, universal screening for mild or moderate sleep apnea during pregnancy is not a standard of care. If a woman comes into pregnancy with an already established diagnosis of sleep apnea and a prescription for CPAP, she should be urged to continue therapy under supervision of a sleep specialist. In addition, women presenting to their OB with severe sleep complaints during pregnancy should be referred to a sleep specialist for evaluation. Both pregnancy, I was diagnosed with gestational diabetes and I had a snoring problem. So after my first pregnancy, I decided to switch to a new OB when I was pregnant with the second child. And I really liked her. She really gotten to know me. She asked me about my diet and to my sleep. So she recommended a sleep study, and guess what? I was diagnosed with mild sleep apnea. I didn't have to wear a CPAP because it was really mild. So what I did was when I went to my dentist, and she made me a sleep device, and this is what was made. So this device helped me with opening up my airway so it doesn't collapse during the night, and I have enough oxygen going in and out, and I was having more restful sleep, even though I have a 1-year-old baby that time. So if you know anybody that might be having a snoring problem or very tired, ask them this question. Do you snore? Are you tired every day? Have you ever heard of sleep apnea? Then they should talk to their physician and dentist about it. If you like this video, click like and subscribe because we have a lot more interesting dental information to share with everybody and other fun videos.